Is an examination about the non-profit servant leader American Heart Association and how some principles of servant leadership could be integrated into one's own healthcare organization. The association was founded by 6 cardiologists in 1924, and this is currently the largest as well as oldest voluntary organization in America that is dedicated to heart disease. Furthermore, in recent years, the stroke disease. This non-profit organization has 22.5 million volunteers and supporters, as well as employing 3,400 workers. Research and evidence-based, this organization invested $4.1 million to improve people's cardiac health. They are strong advocates of public health policies to support communities. Resources and tools are made readily available, such as information pamphlets, nutrition programs, and life-saving supplies. Education supports from the many interdisciplinary health professionals at all leadership levels in the organization support, train, motivate, and inspire employees and customers. The vision is the development of science and the practice of precision medicine will improve the cardiovascular health of individuals and populations. And the mission is so the Institute will integrate and enable research, education, and implementation science activities in precision medicine for the cardiovascular and stroke communities. Servant leadership benefits the leader, shareholders, employees, the organization, and customers. It is a long-term transformation to life and work and supports health equity. Servant leadership, demonstrated in the American Heart Association, serves instead of commanding, showing humility instead of exercising authority, and continues in development of their employees to encourage innovation and creativity with a greater sense of purpose and urgency to improve cardiac health and lifestyle. It is led by an executive committee plus a diversified team of experts. The American Heart Association CEO Roundtable Health Survey showed that employees thought it is important to observe high executive level personnel setting healthy examples. Therefore, employees felt positively inspired and empowered. Leaders establishing a clear vision and plan for the health promotion goals. Leaders empathize through being a visible champion of public health. Staff engagement is encouraged through the programs and policies. To lead by example is a visible and trusting environment. The CEO and multiple levels of leadership are engaged with key communications and provide the resources such as research for support. They are the nation's leader in CPR education training, provide communities with information concerning healthy lifestyle choices, and provide science-based treatment guidelines to healthcare professionals. Education and support is provided to lawmakers, policymakers, and the public. Since 2015, the American Heart Association has established innovative research models, strategic collaborations, access to technology, as well as customer engagement. The American Heart Association is one of the nation's top workplaces and nonprofit employers in 2017. The award was a work environment that empowers and develops people professionally plus personally. They have a strong commitment to innovation, encouraging free expression of ideas. In the work survey, employees expressed they liked community involvement, felt proud of their workplace, were trusted, successful, and rewarded. Servant leaders not only design and implement the workplace wellness programs, they also actively participate. Active participation by leaders shows employees that the leaders are committed to the goals of the American Heart Association. Leaders participating alongside employees are engaged and know their staff. Profit is not solely considered financial, but also produced by people. Active participation promotes longevity of the organization. Communications are the wellness champions distributed in the form of face-to-face emails, newsletters from all levels of leadership. The employee leaders from many departments are liaisons between management and employees. Resources are facilitated by funding from donors, staff availability, many centers in 50 states, places for seminars, and time to facilitate these activities. The American Heart Association's servant leadership has inspiring, effective principles that would be advantageous to one's own healthcare organization. The key priorities are to develop people and their knowledge, building a trusting environment, and achieve set goals. The American Heart Association's first principle is to serve, and this comprises of their own employees and the community. Second is to empower employees, recognizing their skills and knowledge. Therefore, thirdly, engage plus encourage involvement in promoted health initiatives, consequently exemplary examples to each other and the community. These principles will promote effective leadership in one's own hospital with the hospital mission, vision, and values to heal by key practices of listening and delegating. As with American Heart Association, the hospital is striving to inspire healthy living in the community through serving. Robert K. Greenleaf, the founder of the servant leadership model, stated the servant leader is servant first. It begins with the natural feeling that one wants to serve first. In the American Heart Association, the servant leaders gather information first to understand, which includes listening. They empower their employees. When empowered, they can be effective decision makers, clarify goals, delegate, and plan. Furthermore, achieve goals such as healthy hearts. Servant leaders give of themselves in time, energy, and empathy, thereby, by example, empower followers to be engaged, and this encourages involvement in community activities. Attridge, 2009, describes employee engagement as compassion and enthusiasm to work, therefore profit.